Hello, and welcome to the Alliance for Racial Equity and Child Welfare's webinar, Predictive Analytics in the Child Welfare System, starting with the basics. My name is Tashara Halyard, and I'm here at the Center for the Study of Social Policy, where I lead the Alliance. The Alliance was founded in 2004 to provide national leadership on reducing the racial and ethnic disparities in child welfare systems and improving the outcomes for children and families of color who are systems involved. As we work to create more equitable public systems focused on well-being, the topic of predictive analytics is becoming increasingly popular. I'm sure you all are with us today because you've either heard the term buzzing around or your jurisdiction is on the pipeline towards implementation. Today, we will hear from two experts in the field. First, Chris Kelleher, who is a project director at the Center for Evidence-Based Policy at Oregon Health and Science University. Next will be Dalton, who is the deputy director at the Office of Data Analysis, Research and Evaluation at Allegheny County Department of Human Services. Chris will walk us through Oregon's efforts to develop a predictive modeling tool, including the heavy lift he experienced of developing and executing cross-systems data sharing agreements. Aaron will discuss with us how Allegheny County, Pennsylvania developed and implemented their predictive analytics tool, including how they are meeting the need for ongoing staff development and training. The Alliance's series on predictive analytics is framed from an equity lens, and we will discuss today any recommendations or early learnings that Chris and Aaron may have and be able to share about identifying and mitigating the potential for racial bias in predictive analytics. Again, thank you all for joining, and you can also follow the discussion on Twitter by using hashtag Alliance for Equity. That's Alliance, the number 4, and Equity. A few housekeeping things to keep in mind before we get started. This webinar is being recorded and will be available online after today's presentation. Also, all attendees are in listen-only mode. Please use the chat feature in your control panel if you have any issues with GoToWebinar, and we'll be sure to troubleshoot those with you. Also, please use that same chat feature to submit any questions that you have that we will get to at the end of today's presentation. I'll turn it over to Chris.
Good morning. I appreciate this opportunity to speak today. I think it's a really interesting and very important subject, and I'm also looking forward to the discussion at the end. And I think it's something that's it's an important subject to broach, and we should all recognize that it's not something we're going to completely get all the way through today. But I hope it is considered as the beginning of a conversation. All right, next slide. So very briefly about the Center for Evidence-Based Policy. We exist at the Oregon Health and Science University, OHSU. We were established in 2003. We are focused on applying evidence and data to improving collaboration and improving decision-making within government. Next. This is just a map of the states in which we currently work with. It's about half the states in the country. Next. Our focus with Pay for Prevention is the name of the project that we have. We've been working at this for about 6 years. Our focus has been on children 0 to 6 and looking, primarily looking at avoiding child maltreatment that leads to foster care placement. Looking at other things too, but that's been our organizing principle. And asking ourselves the question, how can we better use data and evidence to reduce maltreatment and reduce foster care placement? I'm not going to talk very much about evidence today, although I will emphasize that our approach is one in which we believe that vitally important to look at data, to bring data together, to analyze data. One of the, I think, the mistakes that one often sees though is if you can't analyze data in a vacuum. It doesn't exist in a vacuum. You want, in our view, to understand all of the relevant evidence, because the evidence that's been published, whether some of it's strong, some of it's weak, you want to understand the state of the field, and because that's what allows you to know what evidence you should be pursuing, what data you should be pursuing, understand weaknesses in data, understand where opportunities lie. And so we, next slide. We began our work by conducting an evidence review, all the English language literature related to the 3 questions that you see there on the screen, having to do with maltreatment and foster care, the risk factors, the outcomes, and also the interventions that show any kind of effectiveness in reducing maltreatment. Really looking at the literature, we looked at 3,000 articles, really sifted through, followed a double quality grading standard to then identify really the very, very best. Next slide. You can see just that those bars there. So the blue are all the articles we looked at. The red and the green represents the tiny sliver of articles that we felt represented high-quality studies with reliable conclusions. Next slide. We also, when I mentioned, we looked at the interventions that have shown any kind of effectiveness in reducing maltreatment. And what we tried to do is to identify the elements that are effective across different interventions, not just to find one single intervention and say, paste a gold star on it and say it's the very best, but to say, what do we see as important and effective across different sorts of interventions? And so that's been part of our approach, is to sort of disaggregate the interventions and find out what works best, and not take a one-size-fits-all approach. Next slide. So about data. It's a very quick overview of sort of to contextualize what we've done. And I should emphasize, this is work that has been supported by foundations in Oregon and by the state of Oregon. So what we've done is, this is an oversimplification. I can go into some details. A lot of this occurs in fits and stages, and I'll go into some of that. But essentially where we are is that we have data from 2001 forward, so the last 15 years. The first line there is birth record, and that's the linchpin of our data. That gives us our denominator, because what we have is all children born in the state since 2001. And then that data is linked to, this is a partial list, there's more data that we've linked to, but this is the high-level view of the different programs where we've integrated data. Next slide. Okay, so I mentioned denominator. We think that's crucial. So by looking at all children born in the state, so when we started, our very first step was we got information. We were interested in child maltreatment, so we said, well, great, let's get data on child maltreatment, which was helpful. But then you very quickly get to the point where you realize, well, we want to understand the experiences of all children so we can distinguish between what are the factors that seem to make a difference. If we have two families that are very similar, one ends up having a case of maltreatment and the other doesn't, well, what can we see about what differences there might be? So having the denominator is powerful, and it's really essential for doing any kind of predictive analytics. If you don't have a denominator, you can't really reach statistically valid conclusions. At least that's our view. All of our data is coded, or not all of it, much of it is coded at the census block level, which is the highest degree of specificity that we can achieve. That allows us to really look at the community level. I'll have some maps a little bit later on. We can see what that allows it to do. It is longitudinal because it's basically starts in 2001, goes all the way through, and so that allows you to trace paths, and that we find enormously illuminating. We also devoted a lot of effort to understanding agency cost structures, because inevitably these discussions, at least for us, economics factors into it, because you're talking about how to reallocate resources. And in order to have that discussion well, you need to be able to understand how the resources are currently being allocated. What costs, what are fixed costs, what are changeable costs, and so on. I can talk more about economics, the economic aspects if anyone's interested. But as I said, it's whenever we talk with the people in the legislature and others, like economics always comes into it. So data use agreements and institutional review board. So quick, some of you may be familiar with this, but let me just give a quick background on these two fundamental elements. Data use agreements sometimes operate sometimes they call data requests, and there are many different names that they can fall under, but DUA is the most common one. And essentially that's the agreement that you set down between either between two agencies or, in our case, between a university and an agency that lays out the terms of the data sharing. Again, another term for this is a data sharing agreement. Essentially, in our experience, they tend to be used interchangeably. Institutional Review Board, that is we are at Oregon Health and Science University. We have an Institutional Review Board which reviews all research, anything that involves human subjects really in any way. And we find in our experience that the presence of an Institutional Review Board is really valuable. It has, because the IRB is reviewing the protocol that we develop and is reviewing all of the data use agreements that we set up, that has helped very much in our work with agencies because it gives them the confidence that there's someone else looking at this besides them. And there's someone with an independent eye, someone who does this all the time and is reviewing things. And so we have found it to be very helpful. It introduces some complexity in terms of sequence, however, because you can easily fall into a circular thing in which the IRB doesn't want to review anything until the data use agreements are finished, and no one wants to finish the data use agreements until the IRB has approved it. We spend more time than I would like to recall in that loop and trying to figure out, well, okay, something has to happen first. And so what we worked out is a method in which we negotiate the language of the data use agreement with the agency or agencies. Then we take the language of the agreements, we structure the protocol, we get the IRB to approve the language and the protocol, and then when that is finished, when we have an IRB approval, then we sign all the agreements with the agencies. We had the experience of signing the agreements first, and then the IRB asks for changes, and then you have to re-sign everything. So my 2 cents is to follow, if you're going to engage in something like this, to do it in this kind of way. Next slide. So this is an Oregon-specific thing, but similar structures exist in many places. So take it for what it's worth that this is the way that we have done it here. Within the Department of Human Services in Oregon, there is a unit called Integrated Client Services. In Oregon, what they do is they function as a data warehouse within DHS to bring data together from all the different programs that DHS administers. What we do is we worked out an agreement so that this group, ICS, receives the data from different agencies. We don't receive the raw data, they do. That's important because that means that we're not seeing identified data. We're not seeing names, we're not seeing addresses, we don't want any of that. What happens is the data is sent to ICS. They have matching algorithms because that's part of their job is to match data across different sets of programs. They do the matching, they assign a unique study ID, and then we receive a unified data set that brings everything together and that is de-identified with just those unique study identifiers. On the one hand, it's tricky because we really rely on our partnership with that group, but it's really what makes this possible. And again, I should emphasize, I know I'm moving through this a bit fast. I hope that we'll have time to address any questions that people have about any part of this. Next slide. Privacy always comes up when you're talking about this. There are a lot of details to go into. Some of the high-level considerations are that it is a de-identified data set. And then we have rules that we follow. We call it the 1050 rule, where essentially, particularly in our state where we have, this becomes important in rural areas where you have very small populations. So we have processes for redacting information when cell sizes get too small so that it would become possible to identify individual families. Next slide. Okay. Cleaning and interpreting the data, I think is important to talk about. We use the phrase data hygiene. Sometimes when people talk about this, the focus is so much on getting the data. Everybody, getting the data is what everybody understandably is focused on. But this is a little similar to the point I raised about understanding the relevant evidence. Getting data is only half the battle. You have to understand the data. You have to be able to interpret the data. And so the process of cleaning it and understanding it is something that you really have to devote time and resources to. And so we spent a lot of time talking with people in DHS, in the juvenile justice system and others, to understand what data, talking for every field is entered by a person. What do people who are in the field think about the quality of the data that's being entered? And so in many cases that led us to discount data fields. We can talk about one, just a brief example. The reason for removal field. When we first got our data, we were like, well, we have a field in here that tells us the reason for a child being removed from the home. Perfect. That's great. We were very excited to get that, and because we thought, okay, well, that's going to be a real linchpin data field for us. When we talk with DHS, we talk with people who are case workers, case managers in the field. What we found is that they told us, you know what, I don't rely so much on that field for a variety of reasons, including the fact that they told us that very often what happens is that the reason for removal is not always the reason that's easiest to put down on the form, essentially. And qualitatively, there are many other factors that went into play that led to the decision, but the reason for removal this was the easiest to demonstrate. And does not necessarily, and if you rely too much on that, if you really think that tells you the whole story, you're going to reach the really misleading conclusions. Okay, next slide. So this is, I kind of moved through past the other things because I thought it's valuable to be able to get to the data itself. And in the interest of time, I won't spend as much time on this as I might like, but you can see there's a lot of this, what we have here in this slide is these are the factors that predict a child being maltreated and placed into foster care. There are lots of ways you can cut this. This is, in our case, we decided, okay, we're going to look at foster care placement before the age of 6. This is information that was available at the time of birth in most cases. And the way to read this is, very important, this is if you hold each line that you see here is if you hold everything, if you control for everything else, what is the weight of this factor? A 1.0 is a doubling of risk. So you can see there that the first one, that these proxy measures for poverty, that line is a whole lot longer than any other lines. So what we see is that poverty is the strongest. Also important to point out that this does not mean that, this might be stating the obvious, but WIC, SNAP, and TANF don't cause child maltreatment. They are merely associated, receipt of them is associated with maltreatment. They are not the cause, they're indicators. There are a lot of interesting things here. I'd be happy to circle back to some of this. One of the great reasons to do this sort of analysis in our view is that it really challenges a lot of preconceived notions. We thought we understood things. We look at the data and we realize, well, maybe we don't understand them as well as we thought. And when we control for certain things, we see that, well, something, and one example here is teen mother. You'll see that being a teen mother, actually, if you control for everything else, doesn't matter that much. What matters is whether the teen mother graduates from high school. That is far and away the most important thing. Teen mothers who go on to graduate from high school do not have highly elevated risks of maltreatment. Other important thing, again, I hate to pick and choose here because I find all of it interesting, but it's one thing that jumps out at you is that those gray bars at the bottom 3, are surprising. And we've done a lot of work and want to do much more work to understand why we're seeing that result. Again, this is if you hold everything else, if you control for everything else. If you combine factors, it's not what you see. And we have some hypotheses for some things that may be confounding the data, but in the interest of time, I won't go into all this right now. Next slide. This is what we see here is just an indicator of that the top. So we have, if you look over there on the right side, you see that this is what we see are, this is telling us the elevation in risk. And for half the population, what we're saying is that the risk of maltreatment is basically zero. It's almost unmeasurably small. And as you move up there from right to left, you see very small risk levels until you start to get to the top 1 or 10%. You can, again, slice this lots of ways. But what we see is that 1% of the population, 1% of families, have a 40% elevated risk of maltreatment. So one of the takeaways here is that if you're going to allocate resources, it makes a lot of sense to find out, to be able to understand who that 1% is, because they're the ones who need help. They're the ones who need support. And what we would like to do is to have a system in which we dedicate our resources to that 1%. Next slide. These are paths through the foster care system in our state. This is a 5-year period. We have 12,000 contacts with the CPS claim. And what you'll see, we could delve into this a whole lot, but essentially what you see is paths in the system, children entering foster care, going back to the home, some being adopted, some starting out in the home, and then a couple years later going into foster care. And you'll see those lines there in the middle where we see essentially churning. Children who go into foster care, go back out of it, and then go back into it again. We want to understand who those children are. That churning is, of course, is really traumatic, and we want to do much more research to understand who those children are. What are their characteristics, so that we can make sure that we're helping them as much as we can, and avoiding as much as we can that kind of churning. Next slide. This quickly about costs. If you ask me what is the average cost of a child going into foster care, the answer very clearly is $100,000. That is the average. But what this slide demonstrates is the peril of being too simplistic with your statistics, and because what you see is that actually no individual child ever really costs $100,000. What happens is that most children cost very little because they don't stay in the system for very long. Some children, however, stay for a long time and cost a great deal. And so if you want to have that economic conversation with legislators or, well, with anyone, it really pays to be able to understand which children are which, and to be able to predict as much as you can which children are going to be in which group, so you can devote your resources to the ones off to the right. Next slide. I won't dwell on this. This is a slide. This is from the Robert Wood Johnson Foundation. This is just, I find it useful though to include, because it's the RWJ and others have done really great research to show how much it matters where you live. The zip code is hugely important in disparities, and it's only recently that people have really begun to grapple with this. Next slide. That's so basically what you were seeing there, where changes in life expectancy based on where you lived in just a small, very small region around Minneapolis. Here we have, I mentioned that all of our data is coded at the census block level. So we look at this. We look very closely at this to understand the importance of geography. And so I'm going to just run through a couple different map views using different mapping techniques. So this is one. Next slide. This is another, which is a different, same data, different technique. The advantage of this kind of view is it allows you to zoom in with a high level of specificity, really down to the neighborhood level to see what's going on. Next slide. This is another. This is This has a division of this is a healthcare view of the state based on how the state is divided in terms of Medicaid coverage. So this is important. We use this to talk with the entities that provide the Medicaid coverage so we can talk to them about, well, let's move some resources into some of these areas. Next slide. Let's just move quickly through this. We have a website that we're very proud of that contains a lot of this data. Next slide. Including some interactive graphics that allow you to zoom in, zoom around, and choose different views of the data. Next slide. Here you can choose different risk factors and see how they change things. Next slide. Okay, very quickly, this is in some ways the most important and interesting stuff, but I'll move through it quickly and maybe we can cycle back toward the end of the discussion when we have question and answers. Algorithms, there's a lot of talk, there's nervousness about using algorithms. I really want to emphasize we already use algorithms. We use them in our heads. When people make decisions, they're using heuristics, which is another way of and those heuristics, they're really valuable. They help us get through life. They aid our decision making, but they are very fallible. What we can do, what we want to do, is to use data-based models, predictive models, and others to complement the algorithms that are in our heads and help our decision making. Using data can help us see factors and trends and patterns that at an individual level you will not see. Next slide. Okay, limitations, really important. We talk about predictive analytics. I almost wish that weren't the phrase because you can't predict. What you can do is you can talk about probabilities. You can estimate risk. That is all you can do. You cannot predict an individual's experience or actions. And so what that means is, the takeaway from that, it's very important, is that you can use the model to augment judgments, to complement judgments. They cannot replace human judgments. And they're only as good as the data that goes into them, and they're only as good as the systems that you plug them into. Next slide. So, our principles. We want to identify the families who need help the most. This is about helping. This is not about, this is not about punishing. Far from it. Well, our goal is to find out who needs help before a crisis occurs so we can get them the supports that they need before anything bad happens. And to find out what services are the most effective, what make the most difference, and to get the right kinds of services paired with people so that they're getting the kinds of services that they need, not a one-size-fits-all. Use the data to help us understand that what services will make the most difference, and then to measure what we're doing and understand, are our hypotheses correct? Are the things that we believe help, do they actually help? So measure the indicators and then find out if what we're doing is not actually helping, we need to stop doing it. We need to discontinue the things that are not working. We need to find the things that do work and extend them, and then steadily, over time, build up the things that do work. And that is the end. I think I came in with that in a half hour. So thank you for, that was a lot of information quickly. I look forward to answering questions. And I personally look forward to the next presentation.
Thank you, Chris, especially for that level of detail in your presentation. I'm sure folks will have a lot of good questions after we hear Erin's presentation. Erin, you are up next.
Okay, folks can hear me hopefully. I'm Erin Dalton with the Allegheny County Department of Human Services. I think Chris's presentation laid a great groundwork for this. My presentation is more highlighting the way we're using predictive analytics in the field today, and not a great deal of discussion, though there'll be some about the modeling itself. But I suspect that we can answer questions about that in the discussion section. So thanks again for having us and allowing us to share what's happening in Allegheny. Next slide, please. So just a little bit of background about us. So we were, I'm operational. We work at a government agency. We run, Mark Turner, the director here, runs the department. And for a long time, for upwards of 20 years, we've been running an integrated human services system. So we are not just the child welfare system, not just mental health and drug and alcohol systems. We're all of these supports that you can see on your screens. So we've had an integrated model for a long time and have attempted to build data systems to support this integrated model. Next slide, please. So just a little bit about our data holdings, because it'll give you a sense of the information we have to help produce algorithms and produce predictive analytics. So you can see some of our internal sources. These are largely service systems we run, so the aging services, child welfare. Important distinction here on the drug and alcohol and mental health services is we do not have any private insurance, private pay drug and alcohol or mental health services. This is only county funded or Medicaid funded services, but we also run the homeless system and have that data and so on. We've also, over the past 20 years, long before I started working at the department, been building partnerships with external partners in order to, again, kind of coordinate care, integrate practice. So these data aren't purely for analysis, they're really to integrate care. So just to highlight a couple of those, we've got a lot of criminal justice system data, which you can kind of see throughout those data systems. We have public benefits data. We don't run the public benefits systems. Housing authority, public school data, juvenile probation. The birth records are important in kind of starting all of this process. And we're always looking for other data, but I won't dwell on that at the moment. So next slide, please. So as part of an evolution of using data to support practice, we issued a solicitation about, a little bit actually over 2 years ago. And the solicitation you can find on our website was really broadly defined. It was about decision support systems and predictive analytics in human services. So it wasn't specific to child welfare, though that's where we decided to focus our first efforts. We received a lot of good responses from interdisciplinary teams from around the country and around the world, and partners are listed here. So out of that solicitation, we began work with a PI, the PI out of Auckland University of Technology, Rima Vayasanayathan. She is a strong partner in Emily Putnam Hornstein on the US side. She's at USC. And part of the reason we went with this team was their experience implementing models in the field. So I think folks would probably agree, folks who've been doing this work would agree that the modeling isn't really the hard part. The hard part is putting in place models in the field and the implementation side. They also shared our concern about the ethical issues of modeling and employed on their team a set of ethicists who have issued us a separate report. They also cared about disparities in our current data, which we can talk about probably more on the discussion portion, but I think folks would agree that there are disparities, particularly racial and economic disparities in all of the data that we possess, and so they shared our concern about that. Separately, and I probably will not spend a lot of time on the evaluation, but we issued a separate solicitation to find evaluation partners, so we've selected those and the evaluation is underway. So the impact evaluation is run by Stanford University. The PI there is Jeremy Goldhaber-Fiebert, and the process evaluation is being done by Hornsby Zeller Associates. On the technology side, Deloitte is our technology partner and helped us to implement the model. Next slide, please. All right, so I am going to touch on both of these models. And overlaps a little bit with the first presentation, but I'm going to spend the most time on the first one, which is improving the decision making at the time of call screening. This is the time when we get a call to the hotline and the time that we first have a mandated requirement to make the best decisions we can. But I'll touch briefly on the opportunity of rethinking the prevention of child abuse and neglect. Next slide, please. All right, so there's some numbers here, but in short form, the decision we're trying to inform with predictive analytics here is the screen in, screen out decision. We get lots of calls to the hotline as child welfare systems do all around the country. You don't have a ton of information at the time of that call to make that decision. How do you make that yes/no decision? So I think folks know this, but child welfare agencies around the country don't go out on every call. We don't either. We go out on, as you can see there, about half of them. So really, we're just using the algorithm and the data we have already collected from families and providers and caseworkers to help make this yes/no decision. Next slide, please. So just a little bit about, not really today, it was actually kind of yesterday now, but in Allegheny County, you saw we have rich integrated data, and we've built applications that have been in place for over a decade, probably closer to 15 years, that allow our child welfare caseworkers to access integrated data about the families that they're working with, the families that they've received allegations of abuse and neglect for. So, you know, prior to predictive analytics, they could look in the system if I'm the mother on the case and see if I've had previous criminal justice system experience, previous child welfare experience, previous homeless experience, and so on. So that data has always been in place in Allegheny. Well, not always, but for over 20 years, that data has been in place and available to the workforce for probably close to 15. However, there's, you know, as you can see on the slide, there were sort of no standardized protocols for using these data to make decisions, no systematic way to weight them. I think folks would agree that the human brain kind of can't take into account all of these variables at one time and process how they may or may not lead to risk in the lives of kids. So, so while this data was available, I think it still created great variation in decision making in Allegheny. So we thought an algorithm could help to support decision making at this stage. Next slide, please. So in terms of how we developed the score, and again, this was us working with the research team. The researchers did the majority of the heavy lifting on the modeling. So we rely on that same set of data that's available to the workforce today. And in our case, we decided to predict two different outcomes. So the likelihood or risk of re-referral to the child welfare system given an initial screen out, and the likelihood of a home removal, of a placement into foster care given screen in. These aren't perfect proxies for what we are probably most concerned about, which is harm or abuse or neglect to the children. We can talk at the discussion stage if there are questions about it, about how we ended up choosing those two things. But I'll say one thing about that. I mean, first, I guess I'll say two things. There's no perfect proxy for that indicator, and two, in the case of what we are predicting, this does require something beyond our own workforce. So we're not entirely modeling our own behavior here, which would be probably of many. In the case of a re-referral, the community has to come back in and re-refer that case to the child welfare system. In the case of placement, there is a judge and representation at the time of placement. So the model relies on more than 100 pieces of information in the final model. So it included it started with lots of information from the various data collection systems that I mentioned earlier. Next slide, please. So just to walk folks through a little bit about how this works and ultimately about how it looks to our frontline caseworkers. So in terms of the model, the researchers worked on a screening score that categorized risk in blocks of 5 percentiles. So risk score from 1 to 20, it could be 1 to 100, it could be 1 to 10. In this case, we went with 1 to 20. So a risk score of 1 is the bottom 5% of risk, the least 5% of risk, the least risky cases. In a risk score of a 20, that's the highest 5% of risk, the highest score available. Next slide, please. So as modelers will do, researchers went back and had a kind of a training data set, a historic data set that they used to model the two outcomes I mentioned earlier. They then used data to observe whether those outcomes existed. So it's when I mentioned that that's the likelihood of re-referral given screen out and then the likelihood of placement given screen in. This is long arc risk. So it's not proximate to that call. It's what's the likelihood within 2 years that outcome would occur. So the researchers followed those cases and came up with some findings. So next slide, please. So in terms of the re-referral, so if there's a screen out and then a re-referral back to child welfare, I think what I'm about to share and what you can see on the screen shows you that there's variation in risk between that lowest 5% and that highest 5%. So on the left there, the kids, the families that had a risk score of 1, 1 in 10 of them were re-referred within 2 years of the call. For families who had a risk score of 20, that highest 5% of risk, over 90%, 9 in 10 of them were referred within 2 years of the call. So there's great variation there that suggests we could use the data. Yes, next slide, please, thanks. When we look at the model results for out-of-home care, so out-of-home placements, 1 in 100 of those lowest risk families were placed within 2 years of that index call. And next slide. Where 1 in 2, so half of the kids who had the highest risk score, the risk score of a 20, were placed in out-of-home care within 2 years of the call. So there's great variation there, and I think helped us to believe that we could use these data to support decision making on the front line. So I think we run a pretty good child welfare system, but what I'm about to show you is the way we are treating those calls without the algorithm. So next slide, please. When I say we run a pretty good child welfare system, I think this would be the case in many child welfare systems across the country without tools to help support decision making. So what researchers found were that those 20s, those highest risk cases, we were screening out over a quarter of them. And so if you're running the child welfare system, this is of great concern to you. My bosses wanted to put something in place right away to make sure that we are at least investigating, seeing those kids, those highest risk cases. But there's also lots of opportunity on the low end. So nearly half of the lowest risk cases were being screened in under current practice. Next slide, please. So that was the opportunity point. One of the things we've been trying to do with the research team is validate this model. So we've done validations in a couple of ways. These are the most preliminary results and have yet to really be refined. We did, I'm not going to show slides about the validation we did against critical incidents, but so fortunately there's very few critical incidents in any county and also in Allegheny County. But we did some validation looking at risk scores of those critical incident cases. We call them Act 33 cases, and found that the model was well predicting, or the validation results were supportive of the model. We really wanted to look at injury data, and we have started to do that using the Children's Hospital System. So I've shared a little bit of those results. They are preliminary, but what you see is more hospitalization and more external injuries for kids, the highest risk kids. So looking back at that highest 5% of risk, 45% of those kids had a hospitalization and 16% had external injury. And in the lowest 5% of risk, that's a fraction of the case. So the reason why we do these validations is to assess whether the model is predicting the right things, if those models are good proxies for injury. And so we're digging into that data with researchers over the next couple of months, and we'll have more to share there. All right, next slide, please. So I'm not gonna go through this except to say that there are many systems across the country who are implementing systems that they don't know how they're working. They're sort of black box to the government or black box to the end user. And that's certainly something we did not want to we did not want to do in Allegheny. We want to have full transparency to the way these models are working. So that's my slide to say some words about that. And if folks are interested in the technically speaking how we're drawing data from the various systems and feeding the algorithm, happy to talk about that, probably on a different call though. Next slide, please. So actually, if you could go to the next slide, I'm going to talk about the way this works in practice, and you'll have this visual to kind of accompany that. So this is a little bit detailed and hopefully not too detailed for the audience, but right now, so the way it works is there's an allegation of abuse or neglect that comes into the hotline, and the worker, the call screener, will assess that allegation, and they'll assess it by talking to the caller. They may call other people that the caller gives us collateral information. They will check our information systems. They might read previous referrals to the child welfare system if those existed. And then they will enter an initial risk and safety rating. So they will enter some information on whether they think the allegation is serious from a safety perspective and serious from a risk perspective, based on the information that they have always had previous to implementing predictive analytics. Then that information will lock down, and the predictive analytics score, which we call the family screening score, will run, and it has to be run. And at that time, at that time, it has to be viewed by the worker, and the worker will get a visual like the ones you see on the screen. So you can see we've got it compartmentalized into low, moderate, and high. There is a numeric score. This is the highest risk score for the highest child on the case. And then you will also see on the right that above a certain threshold, there's a mandatory screen-in. And this is a place where our leadership felt that the long-term risk was too high not to, at least in their words, kind of lay eyes on the family and assess the situation more deeply. So once that risk score has been run and considered, the call screener will make a recommendation of screen in or screen out, and then their supervisor, after some discussion, will make the ultimate decision of screen in or screen out. I walk through that in order to show you or demonstrate the way it's working, and also to show that I think it really is decision support, and that this data is augmenting information about the current crisis. So these are two really distinct assessments, and it's an assessment of the current crisis, and then we provide this longer-term, longer-arc risk, and those two pieces of information are combined in order to make a recommendation and ultimately a screen-in, screen-out decision. Next slide, please. I do have some more slides after this, but the next steps are things that are underway right now. So we did go live. This has been in the field since August 1st. We are reviewing the data, every other week with leadership. We are implementing other kinds of continuous quality improvement efforts, trying to understand decision making. I mentioned the validation we're doing with Children's Hospital data, looking at resilience positive deviance. This is something that unfortunately is a little bit harder to do than I want it to be, but trying to understand, if you will, who's kind of bucking the trend. In that case where we had, even in the most extreme case where the risk score is a 20, and the historic data suggests that 1 in 2 of those kids will be removed from the home and placed within 2 years. Even in those situations, there's the other child, so it's only 1 in 2. What's happening with the other half of the kids and families? What are the protective factors that are not leading to those outcomes? So we're really trying hard to understand that issue. I mentioned that we have an evaluation underway. We will tweak this model, and we will likely build, sort of a 2.0 model. In over the next 9 to 12 9 to 15 months. One of the things I think we've learned is that you can't think of everything, so implementing is a good idea at some point. And the words I typically say for that is, if you think the distance between current practice and version 1 is greater than the distance between version 1 and version 2 and version 2 and version 3, then implement, and because there are things that we couldn't have possibly thought of that are happening in the field and that we would have to adjust for in any case. Okay, so I'm going to ask you to go ahead a couple of slides people can see what are on those slides that I'm skipping. It's the process evaluation, which if folks have questions about that, we can answer them. Next slide. The impact evaluation, again, we don't have results yet, so there's not much to talk about, but it's measuring things you would expect us to care about, including whether there's been the effect on disparities. Next slide, please. So next slide, thinking about the opportunity to prevent child abuse and neglect. So in terms of where we are with this process, something I didn't mention is like the many community meetings we have had about predictive analytics in Allegheny County. And so every time we talk about the first model, we're talking about this opportunity to prevent child abuse and neglect with the community. We have some modeling, but even if we decided today that we wanted to put this in place, I would say it's a year away from implementation. We want to understand how the community feels about it, get more, as we share more specific information with them, get feedback, and so on. But the kind of leading question here that is spread across probably 2 slides is, how well do our child serving systems choose the right child at the right time? Next slide. Not that well. More than half of kids who had a critical incident, so who died or nearly died as a result of child abuse, were never referred to the child welfare system before the incident. And so this gets to, it's similar to the previous presentation. Can we move up prevention? Can we move up supports? What can we do at the time of birth? Next slide, please. So, you could generate a risk or needs score at the time of birth. You could do it similarly to the way that we presented the data earlier in the presentation. So you could assign a score between 1 and 20, the lowest 5% of risk and the highest 5% of risk. In the case of the model that I'm going to share, very briefly the results of, we predicted the likelihood of a child welfare case opening by the time the child is 3. So this is not just a call to the hotline. It's not just an investigation. It's an accept for service and case opening. Next slide, please. The results are pretty similar to what I think I heard in the previous presentation. So the highest risk cases, in our case, not the top 1%, but the top 5% of risk, 40% of them have a child welfare case opened by the age of 3. Also similar, very low, rates of child welfare case opening. For the rest of the population, you can see the population rate of case opening is about 6%. And obviously for us, you'll see some of our opportunities for intervention or prevention on the next slide. This is not about anyone's worst nightmare of what people would do with these data. This is about, if we have scarce resources like we do, if we don't have enough home visiting slots for everyone, well then I personally don't think they should go to people with below the population rate risk of child welfare. If we can use these data to provide services to those at higher risk, then we should, my opinion is we should use this information to do that. So next slide. This is, though, an area where we want a lot of community input, and we do worry about the data being used for purposes beyond our intention. So here are some of the opportunities we've been talking with the community about. So how could we use these data? We have a coordinated home visiting intake system. We could use the data there to prioritize home visiting services to those at elevated risk. You could use this needs score to support families who voluntarily walk into one of our 26 family support centers. So if I walk into the family support center seeking childcare, seeking parenting support, seeking opportunities to play with my child in a supportive environment, if I have an elevated risk score, we could share that with the family support center staff in some kind of way. We would have to think through how to do, what we would want to share. And maybe the message to them is really try to engage this mom, and if there are more intensive services that she's interested in, help her to access those. You could go a step beyond that and let the family support centers know all of the high risk, if we don't have enough resources to do it for every child born in the community, all of the high-risk families who live in the catchment area, and you could send parents out, peer supports out to just welcome the family, welcome the new baby, offer support. So then these other two things are things that those are things we could reasonably do under our own control if the community supported it and we thought it was appropriate to do so. These next two things are not things we could control. These require other systems, and they are perhaps both steps beyond where people might feel comfortable. But I mean, hospitals are currently offering services and social workers at the time of birth. They are not, at least in our case, using the best science to decide who should have the privilege of those services. We could imagine working with the hospital system to put that in place. This is a step beyond that. You could also most of the children's trauma goes to a children's hospital in Pittsburgh, and they too don't have a lot of science perhaps behind how they decide to do a full skeletal scan when they think there might be child abuse and neglect, and they may be using less rigorous measures to think about the potential for injury and investigating other injuries. So you could imagine if we want to protect kids and they're not coming to our attention and they are getting hospitalized, the children, you could imagine how we might work with them with community acceptance on something like that. So I think that's the last slide, and hopefully gives you a little bit of a sense of how we are implementing this kind of modeling in call screening decisions and how we are thinking about the opportunities for to prevent child abuse and neglect. Thank you.
Thank you, Erin, and I would like to encourage our audience to please remember that you can join our conversation by using #Alliance4Equity on Twitter, and also sending us a question through the chat feature in your control panel. So I'll start with the basic question that's come in. It gets back to those basics around predictive modeling, and that is, how is predictive analytics different from structured decision making?
This is Erin. I can start. Might be another answer there too from Christopher, perhaps. But I mean, I think the main difference in the way we're implementing predictive analytics is one is operator-driven and the other happens in the background. So in the case of structured decision-making, as I understand it, there are questions that are answered by the worker, and a score is developed based on those questions. And that none of that happens in the predictive analytic model that we've implemented. All you need for us is to get to a unique client, and the score will run in the background and be provided based on who's associated with the case. So I think that to me is the primary difference.
Yeah, I actually don't have that too much to add. I think that's a really good answer. I agree.
Thank you. The next question gets back to Chris's point, the fact that models are only as good as the data. We often hear with data systems that you get garbage in, you spit garbage out. So how can we safeguard against data that may be coming from systems with proven biases like criminal justice, or that might reflect structural inequities?
Yeah, that's an extremely, that's an important question. And I think there is no really easy answer to that. I think that we need to I think the answer is not to disregard that data. I mean, the goal, I think, is to contextualize the data correctly. So data from criminal justice, it's good to have. I think we want that data. We're working right now, we're getting that data in Oregon. But we want to understand its limitations. The same principle, I think, applies to everything that you do. You will never find a data source that is not impaired in some way. You will never find a data source that's perfect, that has everything where you have perfect reliability. It's not going to happen. What you want to do is to do the work to understand the data and to understand its limitations, and to be, I think, humility is part of is something that we talk about here. We want to be humble. You want to be aware of what you don't know. You want to be aware of the limitations and also the biases that exist. That's all you can do, is to be aware and to take those things into account in a way that's as nuanced as you possibly can be.
Yeah, I'll just add a little bit to that. So I think everyone knows these data systems are biased. We do know that. We know that who gets who's arrested is not a function of crime. It's a function of the way we police, and who gets a report to the child welfare system is not a function of child abuse and neglect. We do know that, and I think we are really anxious to have our evaluation results to understand the impact on disparities and on bias, which are two different things. I think and we've wrestled with this a lot. One of the things that the ethicist said in kind of reviewing our work is, I think, straightforward, which is it also needs to be compared to current practice. So it's not to assume that there's not bias in current practice. And I think it's another thing that they point out that is also true is what the outcome is matters as well. So if you think that the investigation is wholly negative, that there's no positive attribute to that, then I think that is different than whether you think that on balance it can help families. So I personally come down in the middle of that. I think the child welfare system can be an effective way to get resources to families who need it to support them at that time. And I also think that an investigation is an invasive thing that, if is not necessary, should not be done. I think the ethicists also come down on a child safety question. So what they want is the most accurate model possible in order to help the system support, help children, identify the right children and families to support. So those are, I think, just a number of the issues that we've wrestled with. What we need, because we don't know how these things work in the field, is the evaluation results in order to understand if similar children are being treated similarly and whether that's gotten better or worse because of predictive analytics, and separately, what are the impacts on disparities, particularly racial disparities.
And I think that was, sorry, this is Chris. I want to just come back again on that. That was a great answer, and I think one of the other, I think there's an important concept, which the concept of data equity. I think there are many kinds of equity that we need to be concerned about, and data equity is one of them. And that part of what that means is what we have is a system which we overweight some forms of data. Criminal justice data would be an example. What we want to do is we need to do better, much better, at getting a truly representative set of data that's disaggregated. That's where we're not lumping people together in ways that really are false to their realities and their experiences. To some extent, when you're dealing with administrative data, you have what you have, and what you can get. But so that's true. And we just try to we acknowledge that we're working with the system as it is. But at the same time, we want to advocate for improving our overall global approach to data and to being much more inclusive.
Thank you. Those are both really great answers that I'm sure we will be digging into more in future webinars during our predictive analytics series. We have a question for you both. Someone chatted us asking, for each jurisdiction, do you have a sense for the proportion of total families that consume the majority of services? For example, do 20% of families account for 80% of costs to systems of care?
I can give an answer first. I mean, I think yes, essentially. I mean, it's not exactly 20 and 80, but yeah, that is clearly what we find. I mean, it's not that different from what people find in healthcare, where a small percentage of the population accounts for the great majority of the cost. That is clearly true. You may recall that slide that I showed with the two big red humps, where we see that most children in Oregon who go into foster care don't cost that much money because they tend not to stay for very long. The problems are resolved. But some stay for a long time and they cost a great deal of money. Further, there are a whole lot of reasons for that. And one of the things that we're very eager to do is to understand what are those factors, what makes the difference, what are the things that lead to a child remaining in foster care for a long time, cycling a lot, all these things which really drive costs. And certainly one of the things we find, adoption is one of the primary drivers of cost. And so what are the factors that really predict adoption, I think is one of the things we want to really get our hands around. And I also, as soon as you get into economics, I think we really embrace the subject of economics. I think it's important to understand these costs because it basically tells us how to allocate, how are resources currently being spent and how can they be allocated better. I think, I won't go on too long about this, but just to put in a plug for having holistic, really broad-based understanding of economic consequences and economic factors. For instance, there's too much focus, in my opinion, on just cost avoidance. Like what's costing money? How can we reduce those costs? And thinking really about child maltreatment damages children for the rest of their lives, and the economic consequences of that last for their entire lives. And so I think what we want when we make the case for better prevention, we are trying more and more to make a really holistic case that says, no, think about the fact that 20 years from now, a child who's not experienced maltreatment and might otherwise have experienced it is going to be a happier and more productive citizen, and it's going to contribute to society, and it's going to pay taxes and all these sorts of things that have economic benefits. And so I apologize if this is long-winded, but I think it's important to really understand the entire economic picture, not just a narrow set of which dollars are going out the door in DHS.
Thank you, Erin. Did you want to jump in there?
I mean, I don't have much to add. I think we do generally see these things as in the data, and I think you can see it a little bit in us being able to show the variation in risk. It's not probably all that different from the variation in cost and the variation in need, and so I think, while not directly to that point, the slides that both Chris and I shared show that variation.
Thank you. I'll point this question to Erin first and then pivot to Chris to chime in. How do you suggest agencies think about the potential for false positives and false negatives, especially as it relates to a decision like removing a child from home? In essence, what do you do when the predictive analytics process gets it wrong? And I know, Erin, you all are still in the early stages of evaluation.
Yeah, I think that's why it's really important to think through what decision you're trying to make and what you're going to do with the information. So I think it does differ a lot if you're talking about, removing a kid because of a risk score. I don't see Allegheny County moving in that direction ever-ish. But where we are using this information, I probably didn't give enough detail on this, but you don't have that much information. You have all of these calls coming into the hotline. We are screening out half of them. Can we use the data we have in order to help inform that decision? And what we're doing with that information is not to say this mildly, but so it's not merely an investigation, but it's merely an investigation. So in Allegheny County, it's probably worth noting that very few kids are removed at the time of investigation. So that number is below 5%. In 95% of the cases, even if we open for services, we're opening for services. We're providing paid supports and casework to support those families in 95% of those cases. So in our case, it is just an investigation which can help us to assess whether there's an imminent safety threat or need on the family side, and to address it at that point, very few of which end up in an immediate removal. I wanted to note one other thing, and that is that absolutely nobody besides our call screeners have access to that information. So we worry a lot about what researchers probably call confirmation bias. So if we were giving that data point that, this family is high risk, or this was a mandatory screen-in, if we were giving that to the investigator, then I think we would worry about that too. They don't have that information, so they go out and investigate the case, right? And that's then what provides the trajectory for the rest of that casework. If that worker sees imminent risk and safety issues, they attempt to address them. If they do not, it stops there. So I think people do need, a short answer to your question is people do need to be really thoughtful about that and what the potential harm is. In our case, the harm, if we were to call it that, would be an investigation.
So yeah, I agree with everything there. So I think that attention to confirmation bias and also selection bias is really important, and something you need to always be aware of, and to actively counter it. It's also, I said this, I think that's something I touched on in my presentation. I think you need to emphasize it a lot, is that modeling should only be used to complement human decision making. The predictive, so in some cases, I guess I would want to reframe the question, because really, if it's a case in which the predictive model is getting it wrong, you're using the model wrong. That's not what it's for. It's not to spit out an answer and you just blindly obey whatever it's just told you. You're using it as another piece of information along with other pieces of information. And you're understanding that this is only talking about probabilities. It's not predicting anything. And also, I guess the other thing, just that, that what you're talking about is delivering services. For our focus at least, we're talking about our focus is on giving support to people, and using this to ensure that we're giving the right amount of support to people.
Thank you both. We have a question, Chris, that stems back to the slide you showed us that has the different levels of indicators correlated to subsequent entry into the system. And there were some that were grayed out, particularly being Black and Hispanic. One of our listeners has asked, can you give us your early thinking about why that is, especially when there are so many Hispanic and Black children who are overrepresented in certain stages of the system continuum?
Yeah, well, yes, we ask ourselves that same question, and we really want to study it more. So these are our only preliminary answers, because we have not really examined this in the level of detail we want. Okay, one thing again, this is hypothesis level stuff. In Oregon, has a large rural population. The rural population in Oregon is predominantly white. And in rural areas, the safety net is much slimmer. And so we see children going into foster care at somewhat higher rates because there are fewer in-between steps. There's just not as much help that can be given to them. So you can hypothesize that that part of what we see is that that in rural areas, which are predominantly white, there is greater entry into foster care because of that slimmer safety net system, whereas the Black and Latino population is not as much Latino. Certainly, the Black population in Oregon is really predominantly urban, where there's a safe, stronger safety net. So we could see that kind of effect. That what we're seeing is really not is that rurality and whatever urbanicity or whatever the right phrase is what we're actually seeing when we look at that. So that's one thing we want to examine. And also, whenever you do any kind of statistical analysis, causality versus correlation is always tricky. There is an overrepresentation. What's causing that? What are the factors? Those are just a couple of thoughts. I could talk about this all day. It's a vitally important subject. Those are a few quick thoughts.
Thank you, Chris. And this question is for Aaron. What roles in your system do you invest in for those jurisdictions just gearing up around predictive analytics? What roles do they invest in around the technical aspects of the technology?
I just want to make sure I understand. What role, like what was the technology investment, or what training about?
Exactly. I think the question is around training. So okay. Who do you invest training in around the technical aspects of predictive analytics? Okay. So I'll answer, and then whoever had the question, if this is not right, then just ask again. So I'll touch on a couple of things, hoping to answer the question. So for one thing, the director here does invest a lot in technology and analytics and analysts. So I think in many jurisdictions around the country, there's a child welfare analyst or 2 child welfare analysts, and their job is primarily to answer crisis requests and submit files to the state and federal government for AFCARs and other federal reporting. We have an integrated department, so it's not just supporting child welfare, but we have 35 or so analysts who work to understand these systems, to work to integrate data, work to use data, work to support the field in using data. So we invest a lot in analytics, and that team, I think, is fairly, relatively speaking, fairly well trained, and we invest in training for them. In terms of the frontline workforce, we have done a number of things to try and bring up capacity and of workers in using data and understanding data. I don't think we envision the frontline workforce having to understand, be able to create models on their own, but we do want them to understand the way we're creating them. So we've invested in high-level kind of analytic training for the workforce, including something we call leadership fellows that was borrowed from leadership fellow or data fellows in New Jersey. So 9-month immersion program in understanding and inquiry and using data to understand their work challenges. So I don't know if any of that actually answers the question, but I'll stop so that we can re-ask it if it wasn't right. Okay, thanks. Our next question, I think, is probably targeted at Chris, since he's looking at the entire state of Oregon. And it says, in work with large jurisdictions, we have seen variations in risk assessment across offices. Is this sort of variation taken into account in your, and if there is significant variation, how is it being addressed?
Yes, there is variation, and that is, I don't know if you recall those maps that we looked at. So you can learn a lot from looking at those maps and zooming in on different areas. So that, we are at the beginning stages of figuring this out. So we're not, I can't say that we're addressing anything at this point. What we're trying to do is better. It was already known that there were, that things really varied across different field offices. That was not something that was unknown to anyone. One of the things, though, again, this gets back a little bit into the causality, correlation questions. Like, it's really different in a rural area from an urban area for a whole lot of reasons. And so, how much of what we're seeing is that sort of thing, just straight up regional differences, and you have different populations in different areas. We have a few what we call, hotspot areas where the rate of foster care placement is much, much elevated over other areas. What's the reason for that? Some of it may have to do with flaws in field offices, but at the same time, some of it may have to do with just differences in those populations, and we just don't know enough to have a definitive answer yet.
Thank you. Erin, do you want to chime in there?
No. I mean, I think the statewide stuff is much larger geography. It's harder to manage. Yep.
Yeah. Okay. So this question is theoretical, but it kind of gets to some of our conversation thus far. It says, in general, we can only speak about the fact that we can only know from data about maltreatment when it is reported. I wonder how good the predictions are, given that we do not know about all maltreatment that occurs. So it seems to be about the conclusions that we can draw when there's only a portion of all maltreatment that we actually know about that comes to the front door of the system.
Yeah, I have a lot of thoughts about that, but Erin, I'll let you go first if you like.
Yeah, I have a brief thought, so that's good. I mean, I think there, there's lots of things we can discuss about that, and I think it's a very, very good point. One thing to note is just our first step in using predictive analytics in call screening does require, we are required to take action on the calls that come to our attention. And that is, that's a major function of the child welfare system. And so what we're trying to do is use data and analysis to make that decision better. Some of the more preventive work goes to the likelihood of various calls being made in the first place. But I'll stop and let Chris respond.
Yeah, that touches on it's interesting to me because it touches on a really important subject, which is that you don't know what you don't know. And this applies to actually all a wide range of the data. We'll give you one example that we talk about a lot. Is that so we see that if you've received addiction services, the rate of maltreatment is higher. Okay. But that's what we know about are people who are struggling with addictions who have received services. We don't know about the parents who are struggling with addiction who have not received service. Presumably, that's a worse situation. Receiving the service doesn't make things worse. At least we don't think it does. But by definition, we don't know about the people who don't get the support. So there is just a significant, it's a limitation of administrative data that you can't know about the things that aren't reported. And another example that we struggle with a lot is the fact that we work with the birth record data. That tells us about the mother and it tells us about the known father. It does not tell us anything about another male living in the house. We don't know about that. Presumably, in many cases, that's a source of that. Other males living in the house are a risk factor that in most cases, we can't know anything about. So it's a great question. It's because it really points to, again, this need for humility and to understand the limitations of the data.
Thank you. All good points, Chris. This question is for you both. We continue to combine abuse and neglect in our terminology, child maltreatment. However, they are very different. Do you all disaggregate in the scores abuse versus neglect for learning and analytic purposes?
Erin?
Yeah, that's a great point. In our case, no. I mean, what we're predicting is, the likelihood of a referral period and the likelihood of, given screen out and the likelihood of a home removal period without regard for whether it's abuse or neglect. I think it when it gets to the kind of interventions you would do. I think just aggregating that and understanding the differences are really important. The vast majority, so I'm not clinical, I've not done any frontline work, but the vast majority of cases that present to us and the way they present are neglect cases. So while we talk about child abuse and neglect, we are largely talking about neglect, but that can, while it presents to us as neglect, usually we do see obviously kids getting hurt and hospitalizations, and so I think it's a great point and offered some quick thoughts about it.
Yeah, I'd say this is a good point, and we are a little bit, I mentioned this during the presentation, we're a little wary of some of that data and how much we can rely on it. But yeah, it's exactly the same thing here. It's neglect is really, I forget what the percentages are, but neglect is a much higher percentage of cases than abuse. So we see that's consistent for a number. As you can tell, I tend to say maltreatment for some of the same reasons that Erin gave, but they are different. They do have different profiles, and to the extent that we want to investigate more to understand how much we can trust the salient data, and because as Erin suggested, they suggest different kinds of interventions and different kinds of supports. It's also true that there is a perception sometimes that neglect is less of a bad thing, and I don't think that is true. There are different kinds of things, but it's not that abuse is necessarily worse and necessarily has worse effects than quote-unquote neglect.
That's a good point. Thank you, Chris. So we are nearing the end of our time together today, and before we close out, I would like to open it up to you all, our presenters, Chris and Erin, for any final thoughts or any resources or ways that people may be able to reach out to you.
Anybody? No,
sorry, go ahead. Okay.
Oh, anybody who's interested, contact me. I'd love to. I'm always interested in talking about this, as you can tell, I think. And I just want to say how much I loved listening to Erin's presentation. That was fantastic.
Great, thanks. Yeah, we do have some information on our website, which I know I didn't provide a link to, but I think if you Google Allegheny County and Human Services and Predictive Analytics, you'll probably find one pager on that. I do think this presentation gets more interesting a year from now when we have results, particularly getting to the point about looking at the impact on disparities and potential for bias and using these algorithms. So if there's an interest in hearing about those results once we have them, we will want to share them with folks, even if they're not good for us or good for what we're intending to accomplish. We absolutely intend to learn from them and make adjustments, even if that means taking the entire thing out, if it doesn't result in the kind of outcomes that we expect.
Thank you, Erin.
Yeah,
everyone agrees.
And also, we do have a website too, so I should just say, so Oregon P4P, the number P, the number 4, sorry, number 4. It is in the slides. Anybody should feel free to go look at that website. And the same thing is, and I will know a lot more, I hope, in a year than we do now.
Thank you, and we would love to have you both back. I think the audience definitely agrees today's presentation has been so wonderful. So I encourage you all to please continue the conversation on Twitter using hashtag Alliance, the number 4 equity, and to also sign up for the Alliance's newsletter under the Alliance tab on our website, cssp.org. Please mark your calendars for the next webinar in our series on predictive analytics. It will be on November 17th at 2 p.m. Eastern. We'll deepen our conversation around equity and predictive analytics with staff at the Public Consulting Group. They'll discuss the various methods being used to perform predictive analytics and trends they've seen in their work with child welfare systems across the country. Please be on the lookout for that announcement and registration link by email. Thank you all again for joining us, and have a wonderful day.